Good afternoon, dear network. Welcome to today. Thank you so much, Lois. We want to welcome everyone for joining us for the first Echo of 2021. Another great year. We've started this year on a galloping note. And we're privileged this afternoon to have in our midst Director, Clinical Care and Diagnostics, Dr. Makupe. You're welcome.
Thank you.
Yes, and we also have Professor Mlenga, Director, Infectious Diseases. It's such a great opportunity to have you, privileged to have you here. And so we've been joined by different provinces on the call. We have all the provinces across the nation. Northwestern, Northern, Western, they are all connected. So we acknowledge your presence on the call, everyone, because we're so many. There are about 138 connections. We will not be able to just call you individually. So this afternoon, I will be your the facilitator, Kozi Aziambo, and we also have people in the hub. We have NOMSA, and the colleague coming from HW21, supported by JPEGO and HESA. We also have Mr. Kampamba, one of our key personnel who helps us in the coordination of this work. So today we'll have two activities, and we'll first have a COVID update of some work that has been done at UTH, which will be shared by Amos Hamukale. And then afterwards, we'll have an exciting moment when we recognize the work of all the network that have been connecting to the ECHO for the past year. So we'll be giving some awards and just recognize a few individuals and offices that have supported this work. And just to encourage you that we appreciate your participation. And we know that this platform is used to improve capacity, and that you've been involved in championing and flagging as a flagship bearer for this work. So that is all we'll be trying to do this afternoon. And then afterwards, we'll have some announcements, and then we'll look forward to the next sessions next week. So I think that having been said, I am going to invite Mr. Hamukale to get ready for his presentation this afternoon. Mr. Hamukale, are you on the call? Could you just speak to us?
Yes, Doc. Good afternoon, everyone.
Thank you so much for joining us. So I will share your presentation. Are you able to see the presentation?
Yes, we're able to see it.
All right, thank you so much. So, Mr. Hamukale, please, you may proceed.
Okay, thank you very much, Dr. Kozia, and good afternoon to everyone on the call. Yeah, so my updates, I'll be looking at COVID-19 surveillance among BIDs at UTH. And this is looking at the work that we've done from April to December 2020. So in looking at the COVID surveillance, there are two approaches that we'll be looking at. And this is, the first one is excess mortality. And the other one is all-cause mortality. Sorry, next slide, please. Yeah, thank you. So in excess mortality, we are looking at the number of persons BID who have died from all causes in excess of the expected number of deaths for a given place and time. So for this one, it doesn't matter what someone died of, but as long as they died as BIDs, we are capturing them and we are using them in our analysis. So this is important because it helps us capture both the direct burden of the COVID-19 and the indirect burden caused by disruptions in access to healthcare services. Then the other approach that we're looking at is the COVID-19 deaths. And this is where we are testing all the BIDs that are coming through UTH for COVID. And we look at those who are coming out positive as COVID-19 deaths. So this also doesn't matter whether someone was died of trauma, but as long as they test positive for SARS-CoV-2, we are considering them to be COVID-19 deaths. So this is also important because it helps us understand the distribution of COVID cases around Lusaka. Next slide, please. We have two objectives, and the first one is to monitor excess mortality among BIDs at UTH. And the second one is to describe trends and risk factors for COVID-19 deaths among BIDs. Next slide. So in looking at excess mortality among BIDs, we are using the BID register as our source document, and we get all the cases that have been reported from January to date. And we also go back to get the historical data. And in this case, we looked at data from 2017 to 2020. And in our analysis, we used data from 2017 to 2019 as our historical data, which gave us the background to allow us to estimate how many deaths are expected in 2020. And then we also got the monthly aggregates for 2020, just to compare with what was estimated, what was expected to be the normal deaths within each month. So with this, there's a tool that we use. There's excess mortality calculator that we use. The link is attached below the slides. People could still look at that. So it's easy, it calculates everything. All you have to do is input the data and it will give you the output, as we will see later. Then in COVID-19 deaths among BIDs at UTH, we are testing from April 2020. We've been testing all the BIDs that have been coming through UTH whenever resources are available. And we maintain a line list for all the cases that we have tested. Next slide, please. So this diagram just shows what has happened in the last year, 2020. So in total, from January to December, sorry, I think I need to make a correction. So that should read January to December. We had a total of 7,756 deaths. And then if you look at April, when we started testing to December, we had 6,022 deaths. And from these 6,022, we managed to test 3,126, which represents 52%. And from the 3,000, we managed to get 220 positive BID cases, which represents 7%. So this shows you to say, in as much as we would want to test everyone, we still have a bit of gaps in our testing, hence our 52% coverage. Next. So these are some of the outputs that we get from the data that we've been collecting. So the graph on your left, which shows blue bars and red bars, just shows for each month, and this is by week. So for each week, how many cases were tested, and the red bars shows you the positive cases that we had for that week. So as you can see, between June and July, we had a spike in the cases. In October, it's blank because for August, it's blank because we didn't have test kits at that time. Then the graph on your right shows you the excess mortality that we had from January to December. So if you look at that gray area represents the 95% confidence interval. So that's anything within that gray area represents the number of deaths expected for 2020. So anything that falls outside that gray area shows you that there is either excess or a number of deaths were below. So each point for that red line, the red line represents 2020, the deaths in 2020. So for each dot, it represents a month. So if I can just draw you back to the graph, the diagram on the graph on your left, you'll see that June and July, we had a spike in cases. And if you compare it to the one on the right, it also shows you that we had excess deaths from what we were expecting. So this trend continued. I'll bring you back to October. If you look at October on the blue graph, so October we tested that number of cases, but we had no positive case. And if you look on the other side where there is October falls within the normal range of deaths expected for 2020. So going ahead, if you look at December, we are beginning to see another spike of cases towards the end of December. Yes, there is that spike of cases, and it also shows on the excess mortality. So this is important because it shows you that even just by monitoring excess mortality, you can already see the effects of COVID in the community just by assessing the BIDs. So this is very important for our surveillance. Next slide, please. Yes, so in terms of analysis, we are also able to analyze the data that we generate. We're able to analyze the distribution by sex and age, and we're also able to do geospatial mapping. And already what we have, hello? Okay.
Go ahead, we can hear you.
Yes, so already what we are beginning to see is that we are seeing a lot of clusters in these unplanned compounds. So this is something that we have decided to investigate further, especially with the coming of this second wave. We'll be updating our outputs on the maps. So I think this is something that is very informative for people who are planning interventions. We need to start understanding why are we having clusters in certain areas when you compare to other areas. Next slide, please. So from the surveillance that we've been implementing, what have we been able to learn so far? So already we are beginning to see that a substantial proportion of BIDs have tested positive for COVID-19. And the other thing is peaks in BIDs testing positive for COVID is coinciding with the excess mortality in the BIDs that we are receiving at the mortuary. Then what we also need to understand is that as long as a case comes in as a BID, it tells you something. It tells you that this case was initially missed. So if we are seeing a substantial number of BIDs testing positive, it's something that should begin to understand, to inform our system. Why are we missing so many people out there? So as it is, we could be having more cases in the community than we are officially reporting. So having this kind of data is something that would inform the system, or at least modelers, they can work with this kind of data to be able to model the real impact of COVID-19 on our communities in Zambia. Next slide, please. So for the recommendations, I think it's important at this point to enhance BID COVID-19 testing in all the districts in Zambia. So with that, we need to strengthen our data quality assessment. We need to standardize the reporting tools that we are using. And I think at Ministry of Health level, there needs to develop an aggregate reporting system to monitor facility and mortuary surveillance implementation. Then last but not the least, I think there is need to introduce an electronic database at the mortuary. If you look at our data, we were only able to start from 2017 to 2019, but would have loved to go further than that. But the condition in which our records are being kept, I think it's a serious limitation if we are looking forward into strengthening our mortality surveillance. So, Chair, I submit. Thank you.
Thank you so much, Mr. Hamukale. We do appreciate this information that you've shared with us. It raises quite a number of action items and some questions. And so we do have a few questions that have been actually raised in the chat box. And so we'll give an opportunity briefly to the network to ask the questions, and then I'm sure you'll be free to respond and give appropriate responses. And then afterwards, we'll have some comments coming in from Director Makupe and Director Mlenga. Any hands from the network concerning this information, very important information? Clarion Mwamba from Western, I've seen you've raised your hand.
Yes, Doc, good afternoon. It is quite an informative presentation. At least we've learned a lot. I think for me, what I've seen from the presentation, I don't know how far we've done in terms of scaling up testing, so that even those BIDs, so that we can even, is there data, the comorbidities that those people are dying of, the comprehensive history, side by side. I think that's my contribution.
All right, thank you very much. Before any response can come through, let's hear from Chikumbi Chambwe Siders.
Hello, good afternoon. I think it was a very interesting presentation. I have a question on how we test the BIDs. Do we do the nasal swabs? And if yes, how specific and how sensitive and specific is it? And are we also doing collecting lung samples to confirm that it's actually COVID? Because sometimes the nasal swabs may be negative, but a sample of the lungs might show that it was actually COVID. Can you kindly confirm if that is taking place?
All right, thank you so much. We've taken note. Chilembwa? Chilembwa?
Good afternoon.
Hello, good afternoon, thank you.
I just wanted to find out if, or maybe it's somehow a concern that maybe postmortems could be done, because I somehow feel that other possible causes of those BIDs are being overlooked because of the issues of COVID, which I'm not saying is not important. It's also very important to keep those records, but those BIDs, we can't keep assuming COVID is the only cause of every death. Of course, you do find it, but I feel you're overlooking other causes that might also be spiking in the community. Thank you.
Thank you very much. Mr. Hamukale, I'm sure you can respond to some of those questions. And I'm sure we do have some people on the call who can also pick up on the other questions that can comment on. Amos?
Okay, thank you very much, Dr.
Especially question 1 and question 2.
Okay, so yes, we have data on comorbidities it's also something that we are tracking. Though there's a team, a separate team that is coming on board to review the verbal autopsies which we have done, so that by the time the data is published, it should have gone through the ICD-10 processing, and people have really made sure to say the cause of death is as documented. So at this moment, we are reluctant to mention about the cause of death, because there's a team which is coming in to review the verbal autopsies. Yeah. But just to, if I'm just to say something about the comorbidities that we are seeing as being common. Most of the people are coming in with hypertension and diabetes. So I think these are the two key causes of death that we are seeing in most of these BIDs that are testing positive for COVID. I did mention to say our source of data is the BID register. So by the time we document this, they haven't yet been processed. So I'll still retaliate to say I'll be reluctant to mention about the causes of death until the process is done. So
no, that is well understood. So how somebody asked a question on how they do the swab. Do you do a nasal swab, oral swabs, and how is the specificity for that?
Yes, so we do the nasal swabs. About the specificity, at this point, I don't think I'm in a position to really answer that. Yes.
All right.
But yes, but also for those cases which are booked for post-mortem, they are also being tested for COVID. And I think at this point, the findings that we found are consistent with the results that we are getting. So not all cases can be subjected to postmortem, but I think the few that we have seen, I think Dr. Mchelenganga and the team have been able to give us the results on the cases that they have seen, and we tried to make a comparison with the cases that we have. There was an agreement. Thank you.
Thank you so much. I think Prof would like to also say a few words on some of the questions that have been raised.
Yeah, I think just on how specific is the nasopharyngeal swab from a dead body. It's comparable to a live body. Remember, what you have there is whether the virus is dead or live, you're going to pick it. So we are confident in the results that come from the nasopharyngeal swabs from the BIDs. There is no room to question whether it's really true positive. Also, if maybe we have the false negatives as well among those. That would be my response to that.
All right, thank you.
I just had one question as well to Mr. Hamukale. First, we congratulate you for the work that you are doing. And this is an important aspect for us to understand the spread of the disease in the community. Now, my question to you, Mr. Hamukale, it's more of a programming question. If you had limited resources and knowing now that the extent of the disease is widespread in the community, would you still consider placing resources on swabbing the BIDs as opposed to swabbing the live ones? What would be your advice, as technical advice to the people who are programming at policy level? Thank you.
Thank you so much. So Amos, would you want to fill in on that one? Or?
Yes. Thank you very much, Prof. Yes, most definitely. I think where resources are limited, we have enough evidence to show that the results that we are getting from BIDs are a reflection of the trends that's going on in the communities. So if you were to ask me between swabbing BIDs and going out in the communities to do mass testings, I would recommend swabbing BIDs. Thank you.
All right, thank you so much for that response. So I have a number of questions on the chat. We've run out of time, actually. We had only set out a few minutes for this one. And I know it has brought up a lot of questions to be discussed and a lot of things to be said. There's some questions on postmortems. Why are they not being done? I think at the end of the day, we do have some people that are actually consenting to postmortems, and some are not consenting. So that goes through a consenting process. And so we do have some cases that are being done so far, and it has not yet been made as a blanket thing. Then we have some questions here about the new variant. What about the new variant? I think I don't think we've been able to run any genomics on all the swabs that have been collected, but I think we're looking into having a study to be able to look at that and see if we can conduct run genetics on any of those swabs that are being collected, for those that are positive. Yeah, so quickly, I think that those would be my quick responses to these questions that have been raised here. So I don't know if Director Makupe, you wanted to say anything to that so far on this presentation? Okay, not a problem. Okay, that's fine, thank you. I think we will end this session here because we've run out of time. We have another very important work and activity in this session, and I would like to quickly run through it because, as you may understand, we are in a response mood, and having both directors here for longer than an hour is actually taking away from the response. So I think we would like, with your permission, everyone, that we may proceed to the next session, where our Director Clinical Care will be able to give awards and presentations to those people that have participated in this important platform and helped us to push it forward. So at this particular time, I'll just invite Director Makupe just to give some introductory remarks about what will be going on, and then we'll proceed into the award ceremony. Thank you.
Thank you, Dr. Ziambo, and good afternoon, team. Allow me to just make a few comments, but before I do that, let me recognize the presence of Director Professor Mlenga, the consultant's presence, the core team at our center here, and I say good afternoon to us as well. Let me say that I need to thank you all for being part of the ECHO network. Without your participation, this program would not achieve the success that we've scored over the last 2 years since we started the program. I would also like to thank the experts that have served as subject matter experts on this platform. They've been our mentors and trainers, sharing their medical knowledge with the multidisciplinary community of healthcare professionals, which include doctors, nurses, clinic officers, laboratory staff, pharmacy staff, etc. As you may all be aware, the Ministry of Health, with support from its partners, is implementing Project Extension for Community Healthcare Outcomes, ECHO, telementoring approach to build the capacity of healthcare workers in HIV, TB service delivery. Since the inception of the program in 2018, we have held weekly video conference sessions in which experts have delivered didactic presentations for knowledge impartation, reviewed challenging cases, and discussed best practices with health workers based at various locations in the country. At the time of the start of the program, we began with 4 provinces: Eastern, Southern, and Western provinces. We, however, now have rolled out to all the 10 provinces with over 250 Zoom connections in a given session. This is commendable, and we need to continue working towards achieving even more numbers. That said, we also want to take this opportunity to recognize some of you for outstanding contribution to the program in the following categories. I'll ask Dr. Koza Ziambo to now lead us into the various categories under which the awards are going to be given. Dr. Ziambo.
Thank you very much, Director. Those are very, very kind words. We do appreciate them as a team. And I think with your support as the Ministry of Health, we feel we wouldn't have gone this far. I mean, this ECHO has actually been a model in the Southern region because of your involvement as a ministry and giving direction. I think we've reached where we are now at this level. So we will politely and kindly ask you to rise so that we may just be able to present the awards, to show them to the camera as people come, so that since people are not here, Madam Nomsa will present and then we can just show it to the camera. So maybe we can just, so that the camera is, so the first category is the Echo Session Attendance. Category 1 is Echo Session Attendance. In this category, we recognize individual participants that have attended at least 50% of the Echo Sessions for the last 12 months. That is from September 2019 to October 2020. These individuals are coming from the following facilities. We are not going to say the names because there are so many names. We didn't want to take a lot of time reading out the names. So we will just mention the facilities where they're coming from, and the individual awards will be given to them as we do our visits to the different facilities. And so each individual participant will receive an ECHO Ambassador corporate shirt. And that's the corporate shirt, Director, that you might want to just show to the, yeah. So that's the individual award that will be presented. So the facilities that have been identified that have got people with more than 50% attendance are Eastern Province, St. Francis Mission Hospital, Lundazi District Hospital, and Chipata Central Hospital. So these will have individuals that have been identified in these places. Then also Lusaka Province, we have Kanyama First Level Hospital, UTH, Chainda Urban Clinic, George Health Center, Makeni Urban Clinic, and Matero First Level Hospital. Then in the Southern Province, we have Sons of Thunder, and then Kabuyu Rural Health Center, Monze Mission Hospital, Nakambala Estates Urban, Mazabuka General Hospital, Shampande Health Center. And then in Western Province, we have got 4 facilities that have been more than 50% consistent. The Wanika General Hospital, Yata District Hospital, Western PHO, the office, and the Senanga Urban Health Center. Then for the Northern provinces,
We requested Dr. Ziambo because we've cut on a bit of time and we've gained some time on what we had planned. Do you have the names of these wonderful people that achieved percent attendance? Do you have them?
So we have a list of names.
How many are they?
We are over 50.
They're over 50.
Over 50.
Well done.
Yeah, over 50, sorry, Director. And so from Central Province, these are some of the provinces that joined us a bit later in the year. So they didn't have that many people, but we did notice some of them who attended at least more than 50% of what they were supposed to attend from the time that they had started. Kawa Central Hospital is one of them. then Mukushi District Hospital. Then on the Copper Belt, we just had the Ndola College of Nursing. So we begged for more participation. Bakula Province, we had also 2 hospitals, St. Paul's Mission Hospital, as well as Samfya General Hospital. So then Muchinga, we had Isoka District Hospital. And then in Northwestern, we had Chitoloki Mission Hospital. Chitokoloki, sorry, apologies for that. And so we are very, very hopeful, and we're looking forward. We know that by the end of the 3rd quarter, I mean the last quarter of the year, we had quite a number of participations coming in from the other provinces. So these individuals have been identified, and they will be. We are going to deliver the shirts, the corporate shirts for them. So I think we can just put our hands together. The second category, in this category, it is the Outstanding Mentor and Leadership Award. This is given to someone who has been the ECO flagship carrier. Of all the provinces and the mentors that have been involved, we've recognized at least one. And this award goes to Dr. Mambwe Chipasha. Mambwe Chipasha, medical mentor. So she receives a shield. Maybe director, you could show it to the camera. So that's the shield that she receives. So thank you so much. And then category 3, the next award is Outstanding Provincial Sub-Hub Coordinator Award and ECO Flagship Carrier. This is someone who has been very active in coordinating. Remember that we had central coordination, then now we moved on to provincial coordination. And so this award goes to Patrick Kaluba, a clinical mentor in Lusaka province. So that's the shield for Patrick Kaluba. Thank you very much. Category 4, this is a Dedicated Sub-Hub Facilitator Award and Flagship Carrier. So this is the facilitator in the sub-hub who has demonstrated quite been active and dedicated and the ECO flagship carrier. So this award goes to Dr. Lusa Milosi, a medical mentor, Eastern Province. Thank you very much. Category 5, the Provincial Sub-Hub Telemetering ECO Recognition Award. This award, just a brief background. In 2020, the program introduced 4 provincial sub-hubs to manage virtual breakout sessions to discuss cases in line with short didactic presentation for that particular session. All the 4 hubs have been performing very well and have since been recognized in this award. And so this award goes to the following provincial sub-hub teams, and this will be ones that will be displayed in the provincial health directors' offices. And so we have got 1 Eastern Province, Lusaka Province, Southern Province, and Western Province. Thank you very much. We appreciate your provincial support regarding this platform. Thank you very much. So now we also have another final category, and that is category 6. In this category, in 2020, MOH recognized the need to expand ECO rollout to other 6 provinces to ensure healthcare workers throughout the country received consistent and standardized information on HIV, TB ECO treatment and care. With the occurrence of the COVID-19 pandemic, the platform became a valuable resource for Zambia's response to the pandemic. The provincial teams welcomed the rollout of the program in their respective provinces and supported its implementation. We therefore would like to recognize these provincial teams and just award them. And so this goes to these 6 provincial health offices, and that is Central Province, Copper Belt Province, Wapula Province, Muchinga Province, Northwestern Province, and Northern Province. This, we are very happy that you were able to quickly implement this platform and be able to allow the ECHO platform to be used and in the manner it was used to help move the agenda for the COVID forward. So we recognize all the provinces that were involved in this one. So thank you very much. I think having said that, this brings us to the end of our ceremony, our award giving ceremony. I'll just invite the directors to sit and then maybe get some final comments from Professor Mlenga.
We are so grateful. And thanks again for your leadership and your support which you've given to the program from the inception. And now we are witnessing the expansion of the ECHO program to all the provinces, and also the expansion of this program to beyond the borders of the country to now where we are coordinating for the region. And this has been possible because of the great collaborations that the Ministry of Health has had, primarily with the Health Resources and Services Administration's Office, HESA, through the Health Workforce for the 21st Century, the HW21. Noms and your team, as you go to JPIGO, please register our thanks for HW21 for this partnership we have had. And we are grateful that it's been a success. And without it, we would not have achieved it. We are very grateful to the support that we keep on getting through the US government. The HESA is one of them, but also through the CDC. They've supported this program from the inception. Directors, you know, from the time that we launched this program in October of 2018, until where we are. And I also need to mention one lady who is not with us, Mary Boyd, Dr. Mary Boyd, in where she is in Nigeria, really contributed highly to the program. And we thank you, Mary. You may not have joined us, but we still remember you. And this program really has helped us refocus on how we implement HIV service delivery, but also TB and even the COVID response. So team out there, those that have received the presents, the awards, we are grateful for your hard work, but we know those that have not received, in the coming year, you are the ones who will be receiving. And we really look forward to another year. We are going to have we have direction over the program focus maybe next week. And again, we are going to emphasize on what we need to focus on in the coming year. So thank you so much, Dr. Ziambo. Dr. Foloshi, again, we are grateful for the way that you've led us in this area. Thank you.
Thank you so much, Director. We are very appreciative of your leadership and your vision that you have for this platform. And Director, we appreciate how you having embraced the telementoring component of clinical mentorship that your directorate actually coordinates. And so I think with this having been said, we would like to thank you so much. And this is where we end our ceremony, and then perhaps release you for other bigger duties as we now give announcements for the forthcoming activities on the platform. Professor, Director,
Thank you.
You are released. Thank you so much. Thank you so much to the network. I know there are a lot of questions being asked about COVID and a lot of unanswered questions. I think Professor will come back here in the mood of discussing some of those issues much later in the week, in the weeks to come. So please just hang on to those questions. They're asking about vaccines. They're asking about which one is going to come, all those things. I think it's, I'm sure you will come and tell us in good time. So for now, I will invite Nomsa to give us the announcements for the next coming days.
Okay, welcome everyone once more to ECHO. We were on break for a short while, and we're happy that all of us dared in this 2021 to participate on ECHO. I know we are amidst the COVID pandemic, but we look forward to engaging ourselves on this network. So I just wanted to make mention that this year, we are looking forward to kind of diversify in the way we are going to implement the ECHO activities. We will have a rotational way of doing our learning activities so that it's more interesting and more engaging. We will have some of the sessions that we may have only a didactic session. Maybe we have Prof just come and give us direct instructions so that we have enough time to interact. And then we will also have some sessions where we will only discuss cases, again, so that we have adequate time. We notice in the year that has gone by that sometimes we've run out of time. So that is also just intended to improve the way we are actually implementing the program. We will also engage the provincial teams on some of the topics. We will have the provincial teams actually manage the entire ECHO sessions at provincial level. So we are trying to just diversify in the way we deliver the ECHO sessions, and we look forward to your participation. So like it has been noticed, for the next week, we decided to actually reschedule the topic for the ART program priorities for 2021 for next Monday, so that we have enough time with Professor and we can go through these sessions and interact with him. So we'll only have a didactic session. So let's participate and let's be part of this program. We want you to also engage those that have not been part of this program in this year. We look forward to more participation. So thank you so much and encourage others. For now, that was the announcement.
Thank you so much. We continue to appreciate your connecting into the network. Kindly take note of the end QR code, which we can use to just register, to show our registration for this activity. It is very important that we take note of this, because it also helps us monitor the attendance and consistency that each one of you has. As we put our data together, we are able to see that so many people have attended from this site and from a different site. So thank you so much for connecting. And so this is where we end our session for this afternoon. I've seen that there's a hand out there. It's Marshall Shankaya. I don't know, you wanted to make a comment? Okay, thank you very much. I think we will now end our session here. Thank you very much for connecting. We will see you next week. Have a good week.